Well, when the threshold to fire drops, so it goes from that -50 to say -60, well, it's easier to meet it, right? So the action potential is going to fire in the nerve pain fiber, and you're going to get that signal in your brain, which your brain is going to say is pain, quicker. So hyperalgesia is when you feel more intense pain for any given stimulus. So like, let's say I took a hammer and I whacked my hand. That should hurt a certain amount. But let's say I then, a few days later, took a pencil and tapped it. If the pencil tap feels the same as a hammer whack, that's hyperalgesia. Okay, and that's from damage to the nerve itself, either damage to the receptors, altered neurotransmitters, the membrane itself is not functional, the channels aren't working, or the signals from the pain receptor through the transmission line to the central processing unit of the brain, something's happening in the brain that is making it get interpreted poorly. And that's called neuroplasticity. And that can go either way. You can become more sensitive to pain or less sensitive to pain. Hyperalgesia is an exaggerated response to a usually painful stimulus. So sure, it's something that should hurt, but it should only be a 5 out of 10, it shouldn't be a 10 out of 10. Again, using that terrible scale. Hyperalgesia is extremely common in people that use narcotics. This is one of the big dirty secrets of the narcotic world. If you give somebody narcotics, you can almost guarantee they're going to hurt more. You can then prescribe them more narcotics, or you can then indicate them for surgery or whatever you want to do. Because opioids change this balance and they make it easier to feel pain, ironically, paradoxically, however you want to look at it. They also cause what we're going to talk about next, which is allodynia. Allodynia means that something hurts that should not hurt. So I see this a lot in my patients that have fibromyalgia. So if you just touch them, just a gentle touch, it hurts. Well, that is not what should be a normal painful stimuli as opposed to whacking your hand with a hammer. That should hurt. But just doing this should not hurt. People with allodynia, it does hurt. Again, associated with opioid use to a great degree. This is post-herpetic neuralgia, we already talked about it, and diabetic neuropathy. This is when the nerve's so dysfunctional or the brain processing is so dysfunctional that things that shouldn't hurt start to hurt. So what's been found in the literature is a lot of people that are on chronic long-term narcotics, if they detox for about a month, 4 to 5 weeks, get off the narcotics, they actually have less pain than they did when they were on the narcotics. And this is why, because you reset that membrane threshold and the voltage-gated firing of the action potential, and they become less allodynic and less hyperalgesic. Next. All right, I see allodynia all the time. You see it in people with fibromyalgia, trigeminal neuralgia, which is pain in sort of the face region, diabetic neuropathy, I see it all the time. And then migraines are associated with allodynia. All of this from nerves firing the threshold set a bit too low. So you can sensitize nerves. So this is one of the reasons we think people get chronic pain. They get a sensitization of the system where it fires quicker, harder, more easily. Okay, so you have to have a change in that threshold that is needed to produce the action potential. That can be from the fluids surrounding the cell might be highly inflammatory. You might have a lot of oxidative stress to the protein structures. The receptors might be damaged. The cell membrane might be damaged. Anything. And then pro-inflammation or pro-inflammatory mediators can trigger these channels and then have cations moving back and forth non-selectively. This is how the TRPV1 channel, so that is actually a channel that's triggered by heat and cold, specifically heat. This is why when you eat hot peppers, it feels hot. You're triggering these receptors that are letting a certain number of ions in to fire an action potential. But if you have enough inflammation around these things, they fire all the time. Capsaicin depletes the area of the neurotransmitter, and then it depletes the ability of a signal to cause that threshold change to make the action potential. So that's how capsaicin works over time. It actually makes things worse short term because all these receptors are let out, but once you get through that phase, then you have less pain.